Bugs, bites, and vectors. Welcome back to Parasitology. Hi, I'm Christopher. In this video, we are moving into arthropods, flies, fleas, lice, ticks, mites, and a few arthropod-adjacent organisms that matter in veterinary medicine. These organisms are easy to dismiss as just bugs, but clinically, they are much more than that. Arthropods can directly live on the patient. They can bite, feed, irritate, and damage skin. They can also transmit pathogens. They can cause myiasis. They can create nuisance, stress, production loss, and public health concerns. And sometimes, the evidence they leave behind is the first clue that helps us understand what is happening to the patient. The goal today is not to memorize every arthropod name. The goal is to build a practical map. If you can identify the group, understand the body plan, and connect the biology to clinical risk, arthropods become a lot easier to manage. What makes an arthropod an arthropod? Let us begin with the body plan. Arthropods share several features that make them who they are. First, they have segmented bodies. Those segments can be grouped into specialized body regions, such as the head, thorax, abdomen, or cephalothorax, depending on the group. Second, they have jointed appendages. That is where the name arthropod comes from, jointed feet. The legs, mouth parts, and other appendages are built for movement, feeding, attachment, and survival. Third, they have a chitinous exoskeleton. That outer covering provides protection and structural support, but it also creates a challenge. If you are wrapped in armor, growing is not simple. That brings us to molting or ecdysis. Arthropods grow by shedding the old outer covering and forming a larger one. Clinically, these features matter because body plan predicts behavior. The shape of the flea helps it move through the hair. The mouth parts of a tick help it attach and feed. The life stage of a mite affects what sample we collect and how we diagnose the problem. Now let's zoom out. This is the larger parasite map. It looks busy, and it should. Veterinary parasites are not one tidy family. Some parasites are animals, some are protists, some are helminths, and others are arthropods. Look at that upper right section. Some of these groupings are true evolutionary branches, and some are practical teaching categories that help us organize clinical thinking. Do not treat this slide as a memorization wall. Instead, use it as orientation. Today, we are zooming into one branch, Arthropoda, within the animal side of the map, and within the broader molting animal group, Ecdysozoa. That zoom in matters because arthropods share enough biology that the group has predictable themes: exoskeletons, jointed appendages, molting or ecdysis, ectoparasitism, vectors, and host contact. Here's the same map with the other major parasite groups removed. This is our working arthropod framework. Within Arthropoda, the groups that matter most in this module include insects, arachnids, and pentastomes. Insects include flies, mosquitoes, fleas, lice, and other parasite-adjacent insects. Arachnids include ticks and mites. Pentastomes, or tongueworms, are unusual arthropod-affiliated parasites that do not neatly fit into the everyday bug image, but they still belong as part of parasitology. The practical reason to learn this taxonomy is that the group often predicts the clinical problem. If I say Diptera, you should start thinking about flies, mosquitoes, biting, vector, and myiasis. If I say Siphonoptera, think fleas. If I say Pitheroptera, think lice. Exodida, think ticks. And if I say mite groups, think skin, ears, feathers, follicles, or environmental exposure. Taxonomy gives us the filing system. Clinical reasoning gives us the reason to use it. Why spend time on arthropods at all? because small things can make big impacts. Some arthropods are parasites themselves. Fleas, lice, ticks, and mites may live on or in the host and feed on blood, skin, tissue fluids, or debris. Some are vectors. Mosquitoes, biting flies, ticks, fleas, and other arthropods can transmit viruses, bacteria, protozoa, and nematodes. In those situations, the bite is less important than what comes with the bite. Some serve as intermediate hosts. Fleas can be involved in tapeworm transmission, and some arthropods or arthropod-like organisms can help complete life cycles of other parasites. Some give us diagnostic clues. Flea dirt, mite scrapings, fly larvae, attached ticks, or lice eggs on hair shafts can point us towards the real problem. And some cause nuisance and production loss. Stable flies, horn flies, screwworms, and other biting or larval forms can affect welfare, growth, milk production, behavior, and public health. The bottom line is simple. Understanding arthropods helps us protect animal health, public health, and the people who care for these animals. This slide gives us a structural blueprint. Arthropods are protected, segmented, jointed, and purpose-built. The exoskeleton is a tough outer covering made largely of chitin. It protects the animal, supports the body, and provides attachment points for muscle. But it also limits growth, which is why molting is required. Segmentation allows specialization. A segment can become part of the head, thorax, abdomen, mouth parts, legs, or other functional structures. Jointed appendages are central to arthropod success. They allow walking, jumping, clinging, feeding, piercing, cutting, or attaching. When we look at fleas, ticks, lice, and mites, we are really looking at body parts that have been modified for particular jobs. This is where the phrase form follows function becomes useful. If we understand the blueprint, we can predict how the arthropod lives, feeds, reproduces, transmits pathogen, or causes disease. Now we divide arthropods into two of the big veterinary teams, insects and arachnids. Insects generally have three body regions: head, thorax, and abdomen. Adults have 3 pairs of legs for a total of 6. They often have antennae, and many have wings, although flies and lice are wingless. Veterinary insect groups include flies, mosquitoes, fleas, lice, and several parasite-adjacent insects. Arachnids have a different plan. They generally have 2 major body regions, the cephalothorax and abdomen. The adults usually have 4 pairs of legs for a total of 8. They do not have antennae or wings, and veterinary arachnids include ticks and mites. One useful caveat: tick larvae have 6 legs. That is a classic exemption and a common teaching point. After molting into nymphs and adults, the ticks have 8 legs. So when you are trying to identify an arthropod, start with the basics. Count the legs when appropriate. Look for the antenna. Look for wings. Look at body regions. These simple clues help sort the organism before you ever get to species. Arthropods do not grow the way mammals grow. They are encased in an exoskeleton, so growth requires a costume change. The process of shedding the outer old covering is called ecdysis or molting. Before the molt, a new cuticle forms underneath the old one. Then the old exoskeleton splits, the arthropod emerges, the body expands, and the new cuticle hardens. That new post-molt stage can be soft and vulnerable, but once the exoskeleton hardens, the arthropod is protected again. This matters clinically because life stages affect identification, control, and environmental survival. Some stages may be easier to find, while others may be hidden or protected. Some stages are more susceptible to control measures, while others are resistant simply because of where they are or how they are protected. The clinical message is, do not think of arthropods as static. They are moving through life stages, and those stages often determine what we see and how we intervene. This image separates three related words that are easy to mix up: ecdysis, exuvia, and eclosion. Ecdysis is the shedding event. It is the process of molting, when the old cuticle or exoskeleton is shed. Exuvia are what gets left behind. They are the shed skins, shells, or coverings after molting. The word is wonderfully memorable because it comes from the idea of being stripped off. In Latin, this could refer to stripped off arms, clothing, or the spoils of war. So if you want a sticky memory hook, exuvia are the spoils of molting, the cast-off remains that are left behind when an arthropod has moved on. In a diagnostic setting, finding exuvia can sometimes tell us that an arthropod has been present, even if the living organism is hard to find. Eclosion is different. In practical insect biology, especially for this course, use eclosion for the emergence of the adult insect from the pupa or puparium. Eclosion can be thought of as the final ecdysis. So don't mess them up. Ecdysis is the shedding process, exuvia are the leftovers, and eclosion is adult emergence. Let's bring this back to clinical medicine. Arthropods matter because they harm animals directly and indirectly. Direct parasitism includes fleas, lice, mange mites, and ticks feeding on or living in association with the host. The result may be blood loss, irritation, pruritus, dermatitis, secondary infections, reduced welfare, or production loss. Some arthropods cause myiasis and tissue damage. Fly larvae in wounds or tissues can range from opportunistic complications to severe reportable disease concerns. Many arthropods are vectors. Mosquitoes, ticks, fleas, and flies can transmit pathogens, including protozoa, bacteria, viruses, and filarial nematodes. That means identifying the arthropod can also predict what diseases may be relevant. Others cause hypersensitivity, toxins, envenomation, or nuisance. A patient can be miserable from biting insects even when no pathogen is transmitted. The take-home is that arthropods are not just things we remove, they are clinical clues. Identify the arthropod, understand the impact, and protect the patient. Thanks for watching. I'm Christopher Lee, and what you know today helps protect everyone tomorrow.